Hey everybody, welcome back. Dr. Houlis here. Today we're going to speak about cosmetic surgery and plastic surgery. Cosmetic surgeons, plastic surgeons, what's the difference? Traditionally, when most people think of plastic surgeons or being in the medical field, when I think of a plastic surgeon, you think of what types of surgeries do they do in training? What is the majority of their practices? So plastic surgeons typically, they do a lot of training in reconstruction, they do a lot of training in burns, breast reconstruction, trauma patients with very limited exposure during their training with cosmetic procedures, the elective procedures. I can't speak for all plastic surgeons, but a lot of them, again, their training is more heavily focused on the reconstruction, the trauma, the burns, the things like that, the pathology of the surgery. Versus cosmetic surgeons like myself, we train specifically and exclusively with the aesthetics and the cosmetic surgery, right? My whole training was focused on enhancements, breast augmentation, breast lift, liposuction, facelifts, abdominoplasties, you name it, that's all I did. I also have some training history in plastic surgery as well. So being in a plastic surgery program and then also doing a cosmetic surgery program, I'm able to speak on this because I have experience with both sides. So that's really the biggest thing, is what is their overall training background? And again, cosmetic surgeons, you have to realize that they spent all their training in the cosmetic surgery aesthetic world. So they don't really get to see the reconstruction world or the burn world or the trauma world. But again, it's not really needed or required. And I also think it gives them more experience and better knowledge because they focus on one thing, more of a tailored trade, you would say. So looking at myself as a cosmetic surgeon, right? How much training did I do? I did over 9 years of training with general surgery residency, plastic surgery residency. I also did a hand surgery fellowship and I did a cosmetic surgery fellowship. Most people, they have typically about 6 years, 5 years. Some people have 8 years. Very few have 9 years of surgical training. So myself, I feel pretty confident and comfortable doing almost every surgery just because of the extensive training I've had. How do you choose between a plastic surgeon and a cosmetic surgeon? Again, credentialing is great, but by the end of the day, you need to be able to sit down with that surgeon. You want to make sure that surgeon answers all of your questions, is respectful, is professional, they're courteous, they have a sense of compassion, they're honest. You want to make sure you don't feel like another procedure or another paycheck to them. You want to be comfortable and you want to have trust with them. So I tell patients, make sure you have a consultation, make sure they answer all of your questions, make sure you're comfortable with them, and then that's how you decide. The knowledge base, I'm sure most surgeons have it and the training, but you want to feel comfortable with your surgeon. You want to have confidence in your surgeon and you want to be well educated and informed.